Hi, my name is Melissa Supermoncool, and I'll be doing a head-to-toe assessment on my patient, Alex. And Alex, do you consent to this?
Yes, I do.
Okay, so we'll start by doing a general survey and also a quick mental status. So what is your name?
Alex.
And what day is it today?
Today is Thursday.
Okay, and where are you right now?
I'm at Esteban South.
Okay, great. And also, what are you here for?
I'm here for exam.
Okay, perfect. And also, my patient seems to be a generally healthy male adult. No disabilities noted. He's alert and oriented ×4. And we'll begin this assessment by assessing his head. So I'll go ahead and palpate his head. There's no lumps noted or masses. His face is symmetrical in size. Can you follow my finger? Pupils are tracking. Good. And let me check your conjunctiva. Conjunctiva seems to be glossy, moist, and pink. Go ahead and cover one of your nostrils. Blow out. Any blockages? No. No blockages noted. Go ahead and cover the other side. Blow out. Any blockages?
No.
Okay, so a little bit of congestion, but that's within normal limits. Go ahead and open your mouth. Say ah. Okay, no obstruction. The mucosa is nice and pink and moist. Very good. And okay, do you have any visual disturbances?
No.
Okay, close your eyes. And what side is this coming from?
Left.
Okay, and how about here?
Right.
And here?
Bottom right.
Good, perfect. Okay, so now I'm going to go ahead and go assess your neck, okay, and check your carotid pulse, one at a time. So I'm going to check for 15 seconds. Okay, so we have 20 pulsations per 15 seconds, so we have a pulse of 80. I'm going to check on this side. Okay, pulses are equal bilaterally, +2 normal. There's no distension noted. Turn your neck. And turn your neck to the other side. And we have good range of motion. So now I'm going to go ahead and assess your arms. Okay? So on inspection, the arms seem to be bilaterally symmetry. And they're warm on touch. And pink, no discoloration. There's a scar noted on the left arm. Go ahead and test for your pulse. So we're going to test the brachial pulse on both sides. They're equal, +2. And then the radial pulse. Also equal, +2, and ulnar. Equal, +2. And then we'll go ahead and check the epitrochlear lymph node, which is above the brachial pulse. There's no swelling indicated. Is there any pain?
No.
Okay, perfect. We'll go ahead and check your strength, okay? So go ahead and squeeze my fingers. Okay, good. And then put up your wrist and resist. So good wrist, and then push up and push down. Okay, and do some ranges of motion. Go ahead and bring your arms to you and back. The patient has good flexion and extension, and go ahead and Make a circle with your arms. Okay, good range of motion. Okay. Okay, so now we're going to go ahead and assess the patient's posterior thorax. And so on inspection, the thorax is symmetrical. And also you can note the inspiration and expiration right at T9 and T10. There's no lesions or rashes noted. The skin is warm to touch and also good coloration. There's no discoloration noted. Now it's time to go ahead and auscultate the back. So go ahead and breathe normally. Okay. Clear lung sounds are noted. No extra noises are noted. Also, we'll go ahead and palpate. There is no masses palpable and percuss. So on percussion, the resonance is low pitched, and everything looks good. Okay. Okay, so I'm also going to palpate the patient's spine, checking for any bulges or masses. There's no bulges or masses. Is there any pain?
No.
Okay, there's no pain indicated. That's good. Okay, so we're done with the posterior, so we'll go ahead and check the anterior thorax. So go ahead and face me again. And I'm going to listen to your lung sounds, okay? Okay, lung sounds are clear bilaterally. There's no shortness of breath noted. His breathing is not shallow. Also, his respiration rate is 18 per minute. So we'll go ahead and, I'm going to go ahead and check your trachea, okay? Okay. So the trachea is midline, mid position, no deviation noted. Okay, so at this point of the assessment, we'll go ahead and check our patient's heart and check all the valves. So I'm going to go ahead and listen with the bell of my stethoscope. And we're going to check the aortic valve right at the second intercostal. Okay. And then the pulmonic. And Erb's point. Tricuspid, right at the fifth intercostal. And also the mitral at the fifth intercostal also. Okay, good. So there are no murmurs noted, there's normal valve sounds, and okay, so now we're going to go ahead and check for the apex. Okay, normal heart tones noted, no murmurs, normal valve sounds. So I'm going to go ahead and have you lay to your left side, and we'll listen to your apex then. Okay, go ahead. Okay, patient's on his left side, and we'll go ahead and listen to the apex. Once again, good valve sounds, no murmurs noted on this side. Go ahead and lay straight on your back. Fine. Okay, so as my patient is lying supine, I'll go ahead and recheck the heart sounds. So we'll go ahead and listen to the aortic again. And pulmonic. Erb's point. Tricuspid. And the mitral. The apex. Okay, all valves sound normal. There's no murmurs noted. S1, S2 is noted. And from here, we'll go ahead and assess my patient's abdomen. So at inspection, the abdomen has no rashes or lesions. His skin is normal. It's warm to touch. His umbilicus is midline. And we'll go ahead and listen to all four quadrants, starting with the right lower quadrant. Going counterclockwise. So left lower quadrant, left upper quadrant, and right upper quadrant. All quadrants have normal active vowel sounds. And so we'll go ahead and do palpation on each quadrant. So we'll go ahead and do light palpations and then deeper palpations, okay? Okay, so light palpation. No masses noted. Organs are well approximated. Go ahead and take a deep breath in. And then we'll go ahead and palpate his liver, which is the upper right quadrant. So deeper palpations, okay? Breathe in. Okay. Liver is well approximated. No hepatomegaly noted. Okay, so we're also going to assess my patient's bladder. So, I'm sorry. So bladder is empty. Good. So now we're going to go ahead and assess his legs. So go ahead and sit back up for me. So on inspection, legs are symmetrical. Good musculature. There's even hair distribution. And go ahead and take off your socks for me. You can see that he's able to flex and extend his knees. Very good. So let me check your pulses. So the popliteal pulse. Equal bilaterally. Very good. And your pedal pulses. Equal bilaterally. And let me go ahead and see your foot. I'm going to do a Holman sign is to indicate whether or not you have signs of thrombosis, okay? So I'm going to push on your foot. Do you have any pain in your calf? And his calf is warm to touch, okay? Go ahead and give me your other foot. Any pain?
No.
Okay. And warm to touch also. So we're going to go ahead and check your hip flexions too, okay? So lay back down. Just a little bit. Okay. And out. Okay, good. And out. Okay, patient has good flexion and extension. And can you flex and extend your ankle? Good. And your other? Good. And let me go ahead and check your cap refills too on your foot. Okay, less than 3 seconds. So he has good cap refill time. So that's good. Okay, so at this point we're going to go ahead and do some neuromuscular testing. And we're going to do a rapid movement test. So I want you to go ahead and rapidly move your hand and palm touching your knees. There we go, just like that. Okay, perfect. And finger to finger. Can you do that? Okay, good. And also, I'm going to write a number on your hand, and you're going to close your eyes, and you're going to tell me what number I wrote on your hand, okay? Okay, so go ahead and close your eyes.
6.
Okay, let me do it again.
8.
Okay, very good. And how about this one?
1.
Very nice. Okay, so, oh yes, let me test this side. Okay, what is this?
8.
Okay, and how about this?
3.
Good. So, good. I'm going to go ahead and have you stand up. And then just walk normally back and forth. Good. The patient's gait is normal, steady. He doesn't seem to have any imbalances or anything. Go ahead and do some tandem walking, which is heel to toe. So just like that. Good. Patient is balanced and steady. Go ahead and do it back over there. Okay, very good. And then we'll do the Romberg's test, which is put your feet together, arms on your side.
Should I go here?
Yep, you can stand over here. Feet together, arms on your side. Close your eyes, and you're going to stand here for 20 seconds. Do you feel any dizziness?
No.
Or do you feel unstable at all?
No.
Okay, and the patient has good stability, very good balance. He's not swaying to any sort of side. Very good. Okay, that's good. And then we'll go ahead and check your range of motion for your back. So can you go ahead and touch your toes? Okay, good. And then can you bend backwards? Good. Side to side? Okay, good. Patient has very good range of motion for his back, and this concludes our head to toe.